If you didn't get a medication or pill directly from a pharmacy, you can pretty much guarantee that it doesn't have what you think is in there. It's probably cut with something else. It's probably cut with something cheaper that's designed to get you high with a less production cost upfront for the manufacturer of that medication or pill. The pills can actually look extremely real. They look like they're from a pharmacy, but if you don't get them directly from the pharmacy, you yourself, then you can guarantee that there's probably something else in there. All bets are off. There are a number of synthetic opioids that are mixed in with heroin and other medications that you buy on the street, such as fentanyl, carfentanyl, metanoia, tasing, and fentanyl, PFF for short. It takes very little of these substances to actually produce a high, making the production cost much cheaper. Fentanyl was actually identified in 2016 and became more increasingly used in the fall of 2020 and thereafter. PFF actually has a reported potency that's similar to fentanyl, both of which are about 100 times more potent than morphine. I've seen some news articles that are reporting fentanyl has a greater potency than fentanyl, but that's not backed up from scientific journals that I've seen. Although I can never truly speak to the motives of drug manufacturers, I assume that the reason PFF is in these is to reduce the cost for them, but they can sell it at the same rate as regular heroin. Over the past several years, more synthetic opioid adulterants have been mixed in with heroin at a lower production cost. The danger of all of these adulterants, such as these synthetic opioids that are mixed in, is that they have an extremely low lethal dose, meaning that there's such a narrow window to actually safely produce a high before they start to develop that respiratory depression and death. The treatment for any opioid overdose, such as even with a synthetic opioid, is to administer receptor blockers such as Narcan. People need to know that whenever they administer even one dose of Narcan, they need to call 911 because that dose of Narcan can wear off very quickly. For the synthetic opioid overdoses, a much higher dose of Narcan is needed, and in the field, if it's a consistent dose of Narcan that's being administered, more frequent doses are needed.